Hi, this is your Houston Chiropractor Dr. Gregory Johnson. We got Connie in here with us this morning, and Connie came here with her roomie, and he comes here about twice a year, and Connie's attended the last couple of visits with him, and she decided she wanted to get checked out today. So we've already done her history and examination. She's a nurse, so she can relate to you. How was the quality of that history and examination, by the way, in your mind, professional mind?
Good. It was
Good?
really good.
Thorough?
Yes.
Good.
Completely thorough.
Yep. So we found out Connie's got chronic neck pain and stiffness. She's got chronic migraine headaches that she's had for over 20 years. And she's been hospitalized as a result of the headaches, right? And you get a headache every day, you said.
Yes, I do.
And she also gets a lot of upper back tightness and stiffness in her upper thoracic spine. And she has, if I can read my own writing here, a little bit of fight or flight stress occasionally. Rib cage pain. She's getting some rib cage pain right up here where her sternum attaches to the ribs, where they attach to the sternum. That's called the costosternal junctions. And if your thoracic spine is subluxated here in this upper thoracic all the way down to the lower thoracic, it affects your rib cage alignment posteriorly, but it also affects it anteriorly. And most often, because people are like this all the time, forward head posture, those ribs right up on top of the sternum, which is why I adjust the ribs out on the x-axis to realign those on the side of the sternum where they're supposed to be. And that should square those shoulders off for you. How you feel sometimes you're just kind of like this?
Yeah.
Stressed out?
Yeah.
So this is her very first adjustment that she's had in like 20 years. She don't remember her adjustments way back when even. So this is her first ring dinger today and first BioPhysics adjustment. So let's show them your posture first then, Connie. I'm gonna have you close your eyes again and bend your head forward and backwards for me. And then neutral. See, I can tell she's a side sleeper. Her head is forward, is translated to the right, but it's rotated to the left. And she sleeps turned left mostly. And her pelvis is also translated right. She has less room here on the right than she does on the left, but the left hip's higher over here too. So she's got a three-dimensional subluxation complex in the lumbosacral and sacroiliac area of her spine. All right, Connie, we're gonna do this one first. This is your first adjustment here. Let's lay you on your tummy. And what you can do to help this process is just breathe and relax, unlike Matt. Now see, her left leg is short by 1/4 of an inch down here. I bring it up, it gets even. I bet you that tightens up in her lower back and thighs. Does it, Connie?
Yes, it does.
Yeah. So she's got a left positive Deerfield test. She's got a positive Knockless test in the lumbosacral spine. Left SI's off right there. Right SI there. There's L5. That's really posterior. All these are posterior. Her lumbar spine's kind of flattened out. And in her thoracic spine, she's got a little bit of an increased kyphosis in her mid-thoracic spine, and that's where these ribs attach back here to the transverse process called costovertebral joint. And then those costovertebral joints, when they're misaligned, goes all the way around to the sternum, and you get costosternal subluxations as well. She get tight shoulders all the time. She's lifting around on patients, dead weight all the time, being a nurse. Tender right there on the right, huh? And right there. Okay, I think her cervicals, from my history and examination on her, are cervicalgenic in nature, meaning that they're emanating from subluxation complexes that she has in her cervical spine, causing neurological interference up into her brain and her head. Okay. I want to adjust your left SI first, Connie. And then we're going to move over to your right one. Yep. And then your sacrum straight down away from L5. And then L5, I'm going to adjust straight P to A. Yep, these will probably be the most sore so far. Yes, ma'am. Good. Keep breathing for me. There you go. That's it.
Oh, that felt good.
Yes, ma'am. I told you were going to like me. Now your legs are even now, and I bet you this already feels easier than that last one did.
It does.
Imagine that.
Oh, that feels good.
All right, we're going to get your neck lined up for you now. Good. Okay, let's turn you on your back now. Good job. I got those Harley wings the same height now. It's just symmetrical, yeah. All right, slide down about a half an inch, right there, good. Okay, so I'm gonna bring your whole head up and over your spine where it's supposed to be. Yep, now if you'll put both arms straight out sideways like Jesus, yep. It's my Jesus adjustment. And there you go, okay. I'm gonna adjust her shoulders, her AC joints, her clavicles where they attach to the sternum, and then her anterior costosternal joints. There you go. Okay, you can relax your hands right there. Were those sore?
Yeah.
Yeah. Okay, let me have this. Atta girl.
Oh,
You should have felt that from your knee all the way up to your lower back.
I did.
Good. Same here. I didn't get that one.
No, you're taking me off.
You can't get out of here without me pulling you and shooting you.
That would felt good.
Mm-hmm. You ain't seen nothing yet. You see how that's kind of skip jumps right there?
Mm-hmm.
That's a subluxation in your glenohumeral joint, which I just adjusted. And then your left one. Perfect.
Oh, I love this.
Yeah. You know the biggest side effect of these adjustments? You feel great.
Well, I felt that way.
You sleep better, you feel great, pains go away.
I'm like popcorn.
You are. That crack egg's gonna love you. Okay, let's come over here on this table next.
Oh, no.
So this is the big green egg, Johnny. Look at her, she's just climbing right up on you.
Oh, I thought.
No, you're fine. Yeah, you're good. Come down this way just a tad. There you go. Perfect. You're gonna let your legs relax. The table's gonna lift them up. You can rest your hands right here. I'm gonna put these big old pins in, lock your pelvis in. There. Atta girl, you're not going anywhere now.
Don't plan to. I like it so far.
Mm-hmm. So on this one, Connie, you want to keep your teeth together. Don't bite your tongue. Breathe through your nose. There it is.
Oh my God.
Yes, ma'am. Now you should have felt that go
Oh, I did.
all the way down your spine.
Felt good.
Yes, ma'am.
Oh my God.
So there's no reason to be afraid of that, right?
No way.
That's good stuff. Okay, let me have your neck. Well, you're falling in place, Connie. Look at you, boy. Crackhead's gonna be delighting on your video. Now that's gonna release some endorphins.
Oh,
You're gonna get some heavy duty pain relief from that. Let me help you. Okay, let's stand over here in front of the mirror. All right, let's scoot you over this way just a tad. There you go.
I feel light.
Yeah, that's right. You're a little taller right now too. I'm just gonna bounce these muscle spindles with this instrument. This will help relax your paraspinal muscles. Okay, so here's your homework, Connie. Shoulders up and back. Let these hands look back like that. You see how it tightens up that whole trap?
Yeah.
No, keep them back there for me.
Oh.
No, forward towards the mirror. Like that. There you go. Then we're going to bring that head straight back and then look back. You're going to feel a little tap on your atlas there. Another little tap there. Now, flex your head forward and backwards again. That should have felt smoother to you.
Yes, a lot smoother.
Cool deal. Well, what would you share with our crack addicts worldwide about your very first experience here at Advanced Chiropractic Relief as a patient? Now, you watched Matt get adjusted for a while now, but you decided you wanted to do it yourself today. How would you describe your first experience here?
The best.
Does your headache feel better?
It feels much better.
Yep.
I feel very relaxed.
Yeah. Feel like your blood's flowing good?
Oh yeah, I feel really good.
More limber?
Oh yeah.
Cool. Should be a little less stressed now too that you know I'm not going to pull your head off.
I'm smiling.
Yeah, that's right.
That's all that matters.
That's right. And you can be smiling too. Just go to AdvancedHoustonChiropractor.com and fill out a new patient request form, and Renee will get back to you within 48 hours. This is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas with Connie from LA, California. We'll see y'all soon.